The SAC, the SAC assessment, are most people familiar with it?
No.
No? Okay, good. Then that's great. Then it's something for you to take away with. I'm going to talk a little bit about informed consent, and I have a very useful tool that we'll make available to you that I think you'll all appreciate. And if I have time, because I know we're running a little bit behind, I'm just going to provoke you with some things to think about if things go wrong. We don't ever want anything to go wrong, but okay, so I'm not going to go through details of all the patient records, but the two things that I want to focus on are the patient or clinician interview. And when I'm seeing a new patient, I always acknowledge to the patient at that initial consult that they're interviewing me as much as I'm interviewing them. From my perspective, it's when I'm seeing a patient for the first time. From your perspectives, you have a better idea of who some of these patients are, what they're like, and sort of how problematic they are. So if you're going to run, when you enter into complicated treatment, then of course the risks are higher. And if things are going to go wrong, starting out with a difficult patient is only going to likely make problems bigger if things go wrong down the road. So you want to be able to identify the difficult patients and know whether you want to treat those patients. So I always, there's always certain clinicians that refer to me as soon as I know it's a referral's coming from them, I know it's a difficult patient. I know it's a highly skilled clinician, and he's going to do most of the cases, but all of a sudden there's that one patient that he doesn't want the problems. So just like when I was a general dentist, when I saw a child was on the schedule the next day, I know a referral coming from that office is going to be a difficult patient. But what I'm looking for in terms of who might potentially be a problem down the road are people who are going to argue with me right from the beginning. So someone who's going to take issue with dental fees, people who want to negotiate from the beginning. If someone who wants to pay cash in exchange for a discount, people who make demands right from the beginning. The patient that phones to say they want the office to phone them to let them know if I'm running behind so they can cancel and reschedule the patient. That's somebody who's going to be difficult all the way through treatment. People who are shopping around, and there's absolutely nothing wrong with shopping. If someone's looking around, especially if they want to see one or two or three specialists before they go on with treatment. We have to respect that the consumer has a choice of doing that, and that goes back to where I say that I respect the fact that the patient is interviewing me. So on a big case, sometimes I will be the first or maybe the third clinician that person is looking to interview to determine whether they want to enter into treatment with that. So of course my job, or your job, is to provide the highest level of service and represent yourself and your office in the best possible way. That's where you come in, right? Someone who is criticizing the previous dental care or the former clinician, this is going to be a very difficult patient, and you can expect that if something goes wrong, you're going to become part of their story as they move onwards. Also beware of the patient who thinks that everything you do in the first appointment or two is wonderful. If they praise you too much, if they love you too quickly, they're going to fall out of love just as quickly. And then of course the person who is the dental expert. They've been on the web, they've read all the literature. They know everything, they know more than you, and everything is an argument, and they want to dictate treatment. Once a patient is dictating treatment, then if something goes wrong, whose responsibility is it? Is it the patient's because they forced you into that? You felt pressured into providing something that maybe isn't quite exactly what you want to do? Who is going to take responsibility for that? The patient certainly isn't, because they're going to look and say, you're the expert. And the courts aren't going to look at it that it's the patient's responsibility, because only one of you has a dental degree. And the one who has the dental degree is expected to know more than the patient who's read everything on the internet. So focusing a little bit more on a case that I brought here, and that is difficulty in terms of treatment comes with the patient who has very high aesthetic expectations. And so you want to make sure that